to our CURA100 AI podcast. Uh, CURA is a super group of psychoanalyst, psychotherapy coach that we are working from different places of the world to make this life a better life, and also to present the value-based medicines that we have done for the last couple of years. We are part of the mentors and coaching student who has worked with Dr. Hameed.
Excuse me,
And
Dr. Pina, your
do you?
camera, you're sideways.
How is my camera? Let me just get it better. What about now? Is that okay?
No, you're
Stuck.
still sideways.
Okay, let me
There
just
you
get
go.
it.
You're correct now.
Yes, I'm
Yes.
okay.
Yes.
All right. So thank you very much. So this is the CURA100 AI podcast. And we have my team from Chicago, Evelyn Fonseca. We also have Alison Pozo Cervantes from Kissimmee, where I'm living and where I'm streaming. Cara Mariusum, she's in Turkey, or she's in New York. No, she's in New York today. And also we have Kuro Purohit, who's going to present about the trends of AI and mental health. And Edward, our intern from Manhattan College, Manhattan University. Dr. Purohit is from India. And Edwards and Hameda are from New York, Manhattan University, and they are in New York. So we're happy to present, I think, their presentations of Dr. Purohit about AI and mental health, and his presentations has been wonderful. So great kind of content. I know you're going to enjoy wherever you are. I'm in this beautiful paradise. It's my club. I already did my 5 a.m. Savers Club. I'm going to do my 3 polyglot languages, German, French, and Italian. Hopefully one day we can do in bilingual, bring different psychoanalysts, psychotherapists from different countries, different languages. Very happy. And in this Holy Friday, we have the pleasure to present Dr. Kevin Purohit from India, and he's going to be presented by Cara Marie Usum. Cara.
Thank you, Dr. Pina. Dr. Kevin Purohit. Kevin Purohit is a recent med graduate from India. He's working as coordinator for the Global Population Healthcare Management Forum, GPHMF, a multi-stakeholder organization that's reimagining the whole healthcare system under the global leadership of Dr. Hameed in Brooklyn, New York. He's advancing the organization's mission for accessible, affordable healthcare globally, focusing on empathetic care. And as a research for CURA100 Global Research Group, he's also contributing to the integration of behavioral health into the primary healthcare office under Dr. Jorge Piña. With experience in holistic care, teamwork, and patient-centered approaches, he's prioritizing human care. Let me introduce Dr. Kevin Purohit.
Hello, everyone.
Okay.
Thank you, Kara, for the wonderful introduction. And hello, everyone, and welcome to the podcast. Today, I'm going to present what are the different trends, which are the future directions into the artificial intelligence in the advent of mental health care. So, without any further delay, let's start with the presentation. I will like to share my screen with you guys. Can you please give me the authority to be the host so that I can share my screen?
Dr. Pina, I think you might have to do that since you're the
Okay.
host. Perfect.
Thank you very much, Dr. Pina.
Thank you. You got the power.
Yes. Okay. So my screen is visible to you guys? Hello. Hello.
Yeah, we can see
Hello.
it. It's perfect.
Okay. Okay. So let's start then. So AI in mental health, what are the current trends and future directions? How we are leveraging technology for better mental health outcomes, presented by Dr. Kevin Purohit. That is me. So let's start
I
with the
don't see. We don't
introduction.
see your video. We don't see your face. It's something that you cannot do or you can do.
I think it is hidden in the screen.
Okay.
Okay. Okay. Sorry for that.
It's
And let's start with the introduction first. So, what are the mental health disorders? They are affecting millions worldwide, and which are causing significant distress and impairment into their day-to-day lives. So something needs to be done right over there. AI has the potential to revolutionize mental health care by providing personalized, accessible, and effective interventions. We are not treating bulks, we are giving precision based medicine. Every individual is different from the other one. So that's why we need a personalized care, and that's why we are developing AI so that it can provide a personalized healthcare approach to the patient. An overview of current trends and future directions in AI powered mental health care. So that's the basic introduction which I would be presenting to you guys today. Let's start with it. Current trends, early detection and diagnosis. AI-powered tools analyze patient data to identify early signs of mental health disorders such as depression and anxiety. Machine learning algorithms can detect subtle patterns in language, behavioral, and physiological signals. So we have trained AI and we have enough database that it can be diagnosing conditions which is pathological, especially if we talk about mental health. And what are the accuracy rates of current AI trend? So accuracy rates are about 63 to 92% in detecting mental health conditions. What are the benefits? Early intervention, improve treatment outcomes, and reduce healthcare costs. We are working on how we can reduce healthcare costs, bring provider and patient satisfaction, bring equity, and reduce healthcare disparity. So it's one of the biggest advent in the modern world that how we can reduce healthcare costs, especially with the advent of AI in mental health. Personalized treatment plans. AI helps in developing tailored treatment plans by analyzing patient data, medical history, and lifestyle factors. AI powered systems can identify the most effective interventions and predict patient responses. What are the benefits? Improved treatment efficacy, increased patient engagement, and better outcomes. We may say that patient is not following up on his doctor. It's because of the importance of rapport building with the patient and the physician. But if we are designing AI in such a way that patient engagement is at its peak, then it's only for the betterment of improving healthcare outcomes. So we are working on personalized treatment plans currently. Next, current trends, AI-powered chatbots and virtual therapies. Chatbots like Chatbots like WooBot and Visa offer conversational therapy, providing emotional support and cognitive behavioral therapy techniques, CBT techniques especially. AI-powered chatbots can provide immediate support and feedback, offer personalized coping strategies and techniques, increase accessibility and engagement in mental health care. It's a noble approach that how I can communicate with someone who understands me. People or patients don't open up in front of the people whom they don't trust. So it's very important that this kind of different chatbots are building trust among our patients currently that they can openly communicate without having any kind of social stigma or fear and can share their concerns of their life, and it can direct them into the right direction. It can prevent suicidal thoughts, it can monitor them, it can provide behavioral therapy that how it it does not impact the quality of their life. So these are the different chatbots which is actually been prevalent in today's healthcare market. Next, continuous monitoring. AI-driven systems monitor patients in real time, detecting warning signals of mental health crisis. AI-powered systems can analyze patient data from variables. Let's imagine that if I am your doctor and if you are the patient and you are wearing a watch, and from that watch I can diagnose that you are having this kind of thought, or if you are having this kind of suicidal tendency, then I can immediately update you or counsel you, and that's what it's been prevalent in this healthcare system or AI integration in mental health. We are analyzing patient data from wearables, mobile apps, and electronic health records. Identify patterns and anomalies indicative of mental health issues. Alert healthcare providers for timely intervention. Mental health disorders requires timely interventions, and that's very much precious that if we are diagnosing any sort of issues in our patients, then we can contact them directly without any kind of hesitations or communication issues, and we can give them therapy into that right specific time. So it's very important, and through that we can continuously monitor our patients. What are the future directions, and what are the future directions in AI? We need to increase its accessibility. AI-powered mental health tools can reach undeserved populations, improving access to care and reducing disparities. We are working on the factor that how we can reduce healthcare disparities, how underserved population receives the right to care which the very prestigious people of our society receives especially. So this is what we are aiming, and this is how we can bring equity by reducing the healthcare costs. What are the benefits? Increased access to mental health services for rural and remote communities, reduce costs, and improve efficiency in mental health care delivery. Emotionally intelligent AI therapies. Future AI systems may become more empathetic and understanding, proving more effective support and therapy. It's how revolutionary that a machine is developing emotions, that machine is coping with human feelings, that how machine can bring effective support and therapy while behaving as a human counterpart and interact with the patients, and can provide satisfactory results in reduce the and improve mental health care outcomes. So it's a very revolutionary thing in today's world. Just a second. Just a second. My app got crashed. Sorry. Sorry for that. And what are the emotional intelligent AI therapies? So more effective treatment outcomes and increased patient satisfaction. So these are the future directions, emotionally intelligent AI therapies. Next, predictive analysis. AI predicts patient responses to interventions, enabling more effective. Just sorry for that. I'm very sorry for that. Predictive analytics. AI predicts patient responses to interventions, enabling more effective treatment planning and better outcomes. Potential benefits: improve treatment efficacy and reduce trial and error approaches. Enhance patient safety and reduce risk of adverse events. There will be reduction of adverse events with the advent of AI in mental health care, and it's a proven fact that how AI is revolutionizing the mental health care. And these are the future directions. What are the challenges and considerations we need to take part in AI? So, data privacy and security. Ensuring patient data and confidentiality and security is very crucial, because data holds wisdom, and we don't need to share our private information with any other human being. So it's very vital that our data is preserved our privacy is secured, algorithmic bias, and fairness. Mitigating bias in AI algorithms is essential for fair and effective care, ethical concerns, and responsible AI development. Addressing ethical issues will be vital for successful AI integration in mental health care. So, these are the challenges and these are the considerations we need to look for while integrating AI in mental health care. So, these were the challenges and considerations in AI in mental health care. And what is the conclusion? AI has the potential to transform mental health care by providing personalized, accessible, and effective interventions. Current trends and future directions show promise, but addressing challenges and considerations is crucial for successful AI integrations. As I already referred to you guys, that we need to address all the challenges and put our considerations into our study design. And that's how we can successfully integrate AI in mental health care. So that was all for today's presentation. Thank you for listening to me, and I hope that you guys enjoyed it. So that was all for today's presentation.
Let's talk
Thank you.
now. Let's talk. So now I'm
Sure.
afraid. Now I'm afraid because last time you
Okay.
brought the machines, the possibility, the ethical component, but what you presented today, it's like a you coaches, psychotherapists will be substitute by AI therapy. It means like if you hold on,
It's not going to.
if you can see AI trends, which is right now, AI trends, and what you presented, it's like a treatment planning, and I know how can I do a treatment plan, and I know how AI is my help to a treatment plan that is efficient, that is complete, that can have all the process together that I cannot see right there. That it take me a week, sometimes a month to do it. But you're telling me that in terms of diagnosis, it's 63 to 93% effectiveness in diagnosis. And all I have to do is to check. And I know, guys, you interns that are learning, most clinicians, they don't know how to diagnose personality disorder, for example, or the anxiety disorders. And then the machine will take it right there with the data that already exists there. So now, diagnosis, treatment plan. And now you're telling me that also AI can have emotional intelligence, can behave like a human. And you know,
That's the
and
beauty.
you know, that's the beauty. He said that's the beauty, guys. So now the trends means also, and that's go for you. I'm serious about it. Cognitive behavioral therapy, that is the only treatment used by many clinic hospitals, have the most research and value-based approach, will take over your profession because it's very easy to replicate. Very easy. See, if that the only thing you know when you get out of your master program, social worker program, from your marriage and family therapist, and when counselor around the United States, that's the only therapy that you really know that is very connected to feelings, history, child history, working with the past, with the present, mindfulness, and then thoughts and idea and the cognitive comprehension of what's going on with you. And that's what it is. Well, that's the paradigm of cognitive therapy behavior. You're gonna be in trouble because human AI coaching and AI digital therapy will do it better than you. So, Dr. Kevin Purohit, you getting most of those guys who are no psychoanalysts, exempt,
Don't get tense,
out of
everybody.
job.
It's not, no, no, it's not going to replace the psychoanalyst or humans, especially. It will be an assistance. It will be helping the psychoanalyst and psychiatrist that how we can interact. It will be a assistant who doesn't take a leave or who doesn't misses his day on Sundays. So it will be a great innovative approach into the future, especially treating our patients who are facing mental health issues. It is it is very accurate. It is about 63 to 92% as of proven data as of now, but it does not have the human tendency and human approach developed very well. It's in the progress of making. It's still data, and people don't trust, and patient don't trust. Patient trust Dr. Pina, and patient trust what Dr. Pina says as of now. But it will eventually.
I thought that Kevin Purohit before, but
Yes,
you know that people in my country
yes,
and in your country go
yes,
to the shaman, to the witch first, to the popular
yes,
as doctor or the person who knows most in your community, and then
yes,
when you are in a crisis, in a severe crisis, then you go to the doctor.
yes,
So what's gonna happen is before I looking for a counselor or psychotherapist, I will go to DeepSeek or to ChatGPT or I will get
yes,
a chatbot. And if it's getting better and better every time, I don't have to call you for a therapy, for a consultation. I might have my response already. Let's say it's gonna start in rural areas where we're not accessible. Most of us go to the major area to practice. But if they start giving results and bringing out cases like DeepSeek happened with a case in New York Times where she went to DeepSeek and she found console and advice, and also the AI can give you music, and she felt like understood, and her suicidal idea went off. So it means like we're going to disappear. Hold on, let me see each ideas from the council. Let's go to Carol soon, then we're gonna go to Fonseca, Allison, and then finally to Hemida and Edward. Mariuso, what do you say about that?
Well, one, I enjoyed the presentation and I'm learning more. I don't know if I should be frightened or not. I had a couple of questions, but the main one was, what do you see the role of the human clinicians, playing aside these AI tools in the next 10 years?
Hold on the question. Write
uh,
down the question. Write down the question. Let's go through everybody, and then you will respond at the end.
Mhm.
Let me go to Fonseca. Comments or question, Fonseca?
I guess actually I was kind of wondering the same thing, especially, kind of being new into that field now and going into that, I'm probably the youngest here going into that field, just starting out, literally just starting out. I just got accepted into a graduate program. So yeah, I guess I'm kind of wondering the same thing, what the future is and how I guess it's gonna work together.
Allison.
Can I say it in Spanish, please?
No,
I don't
no, no.
Okay. I just want to say that you said that that's the 53% of effectivity, and that's good, but that's no good because the therapies can use this also for like help. Yeah, it's like a help. I don't know how to explain my idea in English, but it's like a help, and also for the patients that need to use this like a help. It's not the real treatment. It's not the real diagnosis. It's that. I don't know how to explain good.
Good, good. You did very good. You did very good. Let's go to Edward. Edward.
Well, I'm kind of in the same situation as Evelyn. I'm in grad school, but I'm still very young, 23. So it's like I'm still kind of just trying to find either which way I want to do therapy or what kind of therapy I want to get into. But I have time for that. So
Yeah. Jimena.
I hate to be this person, but I couldn't help but think about the limitations as you were presenting as well, because it kind of makes me think, well, what am I going to be doing in the future? And to kind of piggyback off of what Allison was saying, I don't like those numbers because to me, it's just not good enough. And then the AI can give you an answer, but can it portray it to you in the empathetic way that you need to understand it in order to move forward with your life and fix whatever it is that you need to do? No. So that's how I feel. I'm
You
tired
say
of electronics. That's
you
it.
say no, but the presentation he said the emotional intelligence of AI is being more effective every time. So Kevin Purohit, you have the last word.
Okay, so it's still in making, and I wanted to reiterate that it would not replace Dr. Jorge Pina or all of you guys or even me. It will be an assistance to us that it will help eventually us and it will improve the mental health outcomes. We can be as a human make mistakes. We can diagnose a patient wrong sometimes in our practice, but it will help us to improve our accuracy rate, and especially we can be impactful and we can even test the current AI models as of now, that how whether it is more accurate or whether it is more precise what the AI model is telling.
I
Is
believe
it
you. I
right?
believe you, Dr. Purahit. You be naive. All of you be naive because Bill Gates says, like in
Yeah.
probably 5, 10 years, 64% of all positions are gonna be substituted by AI, and because of that, we're gonna be like working 3 to 4 days a week, most likely.
I'm
So
sold.
are we ready? Are we ready for that, Dr. Purahit? Is gonna
Uh,
be that? Because like let's say I'm in rural. Let's say it's rural. I'm here in Kissimmee. I don't have access to doctors, psychotherapists, but I go to this chatbot and say, "Hello, I'm suffering from this is what I'm feeling. I'm feeling sad. I have some kind of my heart is racing. Also, I don't know what to do. I'm not going out. I'm afraid to go out. The last time I went to the Disney, I was very panicked and I need to call the ambulance. Tell me what to do. Oh, you going for a panic attack. This is the blah blah blah. And then what can I do now? Or you can do this. Okay. And then what next? Oh well, I will give you a resource which is a chat bot or AI coach that you can use, and then that's gonna be most likely the future for us. And I don't know what's gonna happen. But anyway, the conversation is to continue. Let me see what time is it. It's 9:02. Dr. Purahit, yeah, you wanna end up? You wanna say something?
I just wanted to say that it's still in making and it's an incremental slope that AI is advancing, and AI is advancing on so much extent that it will not replace the physicians or humans, but it will definitely replace the humans or physicians who are not adept while using chatbots, who are not adept at using robots. So that's why we need to take an innovative approach that how we can include this kind of chatbots or this kind of AI tools in our daily practice. And that's how we need to evolve our practice on a daily basis. So that's the end message for me. Thank you,
Thank
everyone.
you. Thank you, Dr. Kevin Purohit from India. Wonderful presentation, wonderful discussion by Cara Marie Usum from New York, Alison Pozo Cervantes from La Florida, Zain Hameda, and Edward Malesinski from the College Manhattan University internships, and Evelyn Fonseca, my assistant, who is wonderful, is going to go for the Master of Mental Health Counseling program in Buffalo University. Thank you, and see you on a weekly basis on our CURA100 podcast. Thank you. Adios. Auf
Thank you,
Wiedersehen.
everyone. Bye
Ciao.
bye.
Bye-bye.